I started my particular journey in modelling, for want of a better description, about 5 years ago. And I thought I had been a very good commissioner of health services. I thought I used great evidence, made sound decisions, commissioned services that would make a difference, and then was exposed to the power of modelling and how it can really help you understand proper decision making based on some great data and really challenging questions that you can ask as a whole system to make sure you're getting best value for the money that you're trying to invest. So 5 years ago, that was a whole new experience for me. And over the last 5 years, that journey has developed for us in the national team, but also for the teams that we've been working with. And I think it's starting to gain momentum in health in terms of the benefit of being able to model change before you implement it, be able to have more confidence in some of those decisions that you can make. But it's still not as widely used as it's absolutely not as widely used as it could be. And I think we've still got a job to do to help commissioners understand the power of modelling in a simple way. So it can get quite complicated, modelling, and as someone who has no training in it, no particular background in it, I'm not a technical person in the slightest, and even though I'm a really big believer of it, I look at some of the models and some of the pictures people use, and I have no idea what they're talking about. And that's from somebody who really, really believes in the whole approach. So how do we get to being able to sell to commissioners in a simple way what modelling can do for them, that people who are busy and need to make decisions but also have 101 other things to do can do so in an easy way? And I think that's still a challenge that we need to overcome. For long-term conditions, we have been able to improve the data that's been available to really understand the population, to understand at a national level but also at a local level what's going on, what the changing demographics really look like, what the challenge of comorbidity really looks like, what some of the ageing issues are starting to enable us to understand. So the approach to modelling has helped us really ask better questions, but also as a result of those questions improve the data, both the quantity and the quality of it, so that we can therefore really understand what some of the answers are that give us better outcomes for patients. So it's been an incredibly important journey for us to be able to use modelling tools and approaches to how to understand data to enable much better commissioning decisions to be made as a result.